Hi again, everyone. You are now halfway through the training modules. Congratulations. Welcome to the PREATS Representative PREATS Training Module number 4, the process for serving students. And again, this is number 4 in a series of 6 for PREATS Representatives. Our agenda is as follows. I will be reviewing VRS Student Career Services, the role of the PREATS representative. We'll talk a little bit about case notes and then have another quiz. So let's get into VRS Student Career Services. So who we are, even though we serve students who are potentially eligible for VR as well as students who are eligible for VR, we are still one program, Vocational Rehabilitation Services, otherwise known as VRS. We provide student career services, also known as PREATS, to all high school students we serve. This needs to be our unified, front-facing message from VRS staff to all schools, students, families, and other stakeholders. It is why we have just one set of marketing materials for all students. Speaking of outreach materials, linked on this slide are the following primary materials for you to use to market our services to students. So we have a short video, a one-page flyer, and we have other information for students and families as well as school staff on our DVRS webpage. Another message to our stakeholders, especially schools, is that there's no wrong door for referrals. There are 2 VRS staff that serve every school, and they work together to make sure that students get PREATS and any other supports they need. So in other words, schools can refer a student to a PREATS representative or to a counselor, and that together, the 2 of you will be figuring out the best way to meet a student's needs. So the continuum of VRS Student Career Services. As much as possible, we want PREATS services to potentially eligible students, or PE, to be the first step for most students referred to us who are in grades 9 through 11. These services get students started in our VRS Student Career Services. They also help us understand who needs more intensive VR services, as well as who has gotten all they need from that first level of service. Step 2 is VR services for students that need more support. Of course, PREATS are still provided, but other services can be provided as well. And they can last as long as needed until a young person reaches an employment outcome. There should be no harm in getting a student started in PE services first. We can always help them apply for the VRS intensive program at any time if they need more. And there also isn't a need to have schools, students, or families choose which type of service to apply for. As the default, have them start in PE services whenever possible. On the flip side, if a student or family asks to apply for VR services, we wouldn't deny them that option. It is also important for everyone to understand that this graphic represents our ultimate agency goal, the most ideal situation. But each team at the leadership of their RAM may have slight differences in how this continuum works due to any number of factors that can come into play, such as rural versus metro service delivery, staffing, options available in schools, as well as provider options that are available. And here's another way to look at that ideal system. It's at an even broader level because we can't forget that schools are the primary provider of PREATS. So the outermost circle on this graphic represents all students who are in high school, regardless of whether they have a disability or not. And our state requires that every student have a personal learning plan, otherwise known as a PLP. And as a part of each school's PLP process, which they can call it different things. Some schools call it their career and college readiness programming, or they might have a different name for the PLP. but there should be many different ways that students can get support to explore career options. Some schools have career planning embedded in certain classes. Some offer electives within career and technical education courses. Some offer job shadow days and all different types of events. The next circle represents all students with disabilities who need extra support beyond what is provided in the general education population. Of course, those students have access to the PLP activities and supports just like any other student, or they should have access. But then those who are in special education also have additional support through transition services as a part of their IEP. Then the next circle brings us into VRS. We would like to see that students with disabilities that don't get their needs met by school services alone through the PLP or the IEP, that those students get access to our VRS services for potentially eligible students first. And then the final innermost circle represents those students who need more support than they can get through the PE services. And those are students who would then be served by our intensive VR program. This slide indicates what each staff person and service can provide to students. So you'll see on the left that the PREETS representatives who provide services to potentially eligible students are able to provide the 5 required pre-ed services, again, job exploration counseling, work-based learning experiences, etc. You are also able to provide the 4 pre-ed coordination services, attend IEP meetings, work with career force partners and employers to develop work-based learning, work with schools to coordinate pre-ed, and attending person-centered planning meetings for students that that have a Medicaid waiver. And lastly, you as a PREETS representative, you're also able to provide auxiliary aids to students that have disabilities that impact communication. And again, that's one service and support of PREETS that you are able to provide, and it's unfortunately the only one. But then on the flip side, our VR counselors in providing VR intensive services are able to provide the same things as a PREETS representative, but in addition, they're able to provide a full range of services in support of PREETS, and we have a sampling of those things listed on the slide. So intake fees, work-based learning coaching, maintenance, transportation, etc. And then, of course, they're also able to provide any other VR service. And this graphic represents the 3 primary scenarios for how students typically move through VRS student career services. So student A has applied for pre-ed services for potentially eligible students, and then they receive those pre-ed services. This student doesn't need anything beyond the 5 required pre-ed, so they never apply for intensive VR services through a counselor. Student B has also applied for pre-ed services for potentially eligible students and then receives those services. However, they need more support than just the 5 required pre-ed services, so they apply for intensive VR services. If they are eligible for VR and are within our priority categories 1 through 3, they then receive both pre-ed and other needed services from the counselor. And there's student C, who applies for VR with the VRS counselor without starting with the PE services first. If they are eligible for VR and within priority categories 1 through 3, they will then receive both pre-ed and other VR services from the counselor. So again, that represents kind of the 3 tracks that students can take. It's also important to keep in mind that pre-ed should look the same whether a student is potentially eligible or eligible for VR. So what does that mean? It doesn't mean that we take a cookie cutter approach with all students or provide the exact same thing to each student, but it does mean that the 5 required pre-employment transition services are defined the exact same way and that for both eligible and potentially eligible students. and that when we refer a student to one of our community partners, they should provide them the same way to both populations as well. Furthermore, pre-ETS representatives and counselors essentially go through the same process in providing pre-ETS. Both assess a student's pre-ETS needs. Both review service options through informed choice discussions, which we're going to talk about more in a little while. And both ensure that the pre-ETS services are adequately provided. Who provides the services is what might look a little different. We ask pre-ETS representatives to refer students to contracted providers as much as possible. Counselors may provide many of the pre-ETS services directly, but they can also keep in mind that they can refer students to the providers as well. And then lastly, on this slide, we mentioned group services. Right now, as this is being recorded, we're in the midst of the COVID pandemic, so group services can be more difficult to provide, although they are provided virtually and can continue to be provided virtually well into the future. But if you are providing more in-person services, it can be easier to go out to a school and have group services available. We just want you to keep in mind that group services can include both students eligible and potentially eligible altogether. So just something to think about as you're planning with the schools and working with the counselor to provide services. So now let's move into the specifics of the role of the pre-ETS representative. Here's a high-level list of what is included in the role of the pre-ETS rep. So a pre-ETS representative provides outreach to schools and recruitment of students. They enroll students into the program. They assess the needs for pre-ETS. Pre-ETS representatives refer the students to providers, and they also provide follow-up, which can include referring students to VR intensive services as needed. And I'll go through each of those items. And we're going to start with outreach and recruitment. So outreach to schools includes developing and fostering relationships with school staff, and it will be done in collaboration with counselors that are also assigned to schools. And of course, that teamwork is crucial. The team outreach also includes meeting with and advising school staff regarding pre-ETS for all students. A part of that work is also assessing what pre-ETS the schools already provide. And remember, our work is about filling in the gaps for what the schools are not able to provide. We also have a number of resources available for school staff on the Information for High School Staff page on our DEED VRS website, and it's linked here. You'll see that we have a video for school staff, a link to our staff directories, a VRS Education Partnership Guide, and much more. So again, I would really recommend that you take some time to look at that page and understand all the resources on there. Certainly reach out to me if you have any questions about any of that. All right, next is student recruitment. There can be any number of ways to work out a recruitment plan for students. The activities can include special events or group meetings with students at schools and elsewhere. It can be collaborating with the counselors to generate referrals, as well as working with other community programs. The recruitment will include providing and collecting the necessary paperwork that verifies that the student qualifies to receive pre-ETS, and of course we'll get into that in a few minutes. The focus of referrals of pre-ETS representatives is on younger students, those again in 9th through 11th grade. And that would include any student with any disability. So it could be those that have an IEP, it could be those with a 504 plan, students with disabilities that don't have an IEP or 504 plan, but have other documentation of a disability. And pre-ETS representatives can continue with these students until they no longer meet the definition of a student with a disability if they don't have needs beyond those 5 pre-ETS services. And again, in the cases where the student does have needs, then you can help them apply for VR services through a VR counselor. In case you weren't aware, special education law allows for certain students to continue in secondary school through the age of 21. These are typically students that have the most significant disability-related needs, and many school districts have what are called 18 to 21 transition programs. But in the rural areas, many school districts don't have those options because they're not able to support them without having enough students. But in either case, PREAS representatives wouldn't typically serve students who are in 18 to 21 transition programming. We ask that the counselors would take all of those referrals. Data practices is an important topic for all of our VRS staff to know about. You will have a separate training related to this subject. And there's also a data practices chapter in our policy and guidance materials. You're encouraged to reference that chapter whenever you have questions. But I'm going to review some key points just to make sure we emphasize some of the more important things related to data practices. First, know that you are able to obtain certain information about students from the schools without obtaining a release of information or a privacy notice. This basic information about a person is considered directory information. It can include a student's name, address, phone number, or email, as well as that same information of their parent or authorized representative. If you're obtaining information from a student or their parent or authorized representative prior to them applying for services, for example, a good example might be you're attending like a full IEP meeting, then you're required to give a pre-application privacy notice, and we have that document linked on this slide. However, just keep in mind, if you are just going, say to an IEP meeting to explain services, or you're giving orientations to students, you're just giving information, there's no need to get that pre-application privacy notice. So that's only if you're going to be collecting information about the person prior to them applying. So signed release of information, when is that needed? It's needed when you're exchanging information with, say, the school beyond getting that directory information. So some examples might be if you need to ask the school for disability verification, or if and when you want to update each other on a student's progress. It's a best practice to get a signed release for most students that you're serving because it really is important to be coordinating with the school. You also need to get a signed release when the student turns 18, so for their parents. And of course, anyone else that you're exchanging information with, you'll need to get a release, except there's one exception that PREAS representatives in serving potentially eligible students have. And that is when you are exchanging information with our VRS contracted providers. So our community rehabilitation programs, or CRPs, or the limited use vendors, LUVs. So that is a really nice thing. It really helps in delivering services. So when you make referrals, exchange information with our contracted providers, you do not need a signed release in serving potentially eligible students. Our students who are eligible, our counselors do need to get a release. So you have a benefit there. What is an authorized representative? I just wanted to clarify that piece because I know that term is in many of our materials. An authorized representative is anyone named by the individual in writing to act on his or her behalf, or anyone court appointed to act on behalf of the individual. So that's just a really broad term to say anyone that's appointed to act on behalf of a person. This says a little bit more about authorized representatives. So a student's parent or guardian is essentially their authorized representative. But sometimes if a student doesn't have an engaged parent, a surrogate parent might be an option. And we have linked on this page a site. It's on a page on the Pacer Center website that gives you a little bit more information about surrogate parent in case that's something you want to look into, or if a student has a surrogate parent. There's also, we have a VRS authorized representative designation form that can be used if a person wants to authorize another person to act on their behalf. And we also have that form linked on this slide, so just keep that in mind. Sorry about the background noise. All right, enrollment. On this slide, the application form that must be completed in order for a student to receive pre-eds as a potentially eligible student is linked. First of all, note that when you are printing this out, that we ask that you print it on light yellow paper as much as possible. And the reason being that school staff and others might get this application mixed up with our application for VR services because they look pretty similar. And so that application is printed on white paper. So just to be able to distinguish them, we ask that you print them on yellow paper. Let's take a moment to go through that application form together. So I'm going to pull it up here. Let's go to the first page. Just some important things for you to know about the application. First of all, you'll want to customize it for yourself. So you can, in this section that says return this completed form to, you can put your contact information so that they come to you. The next piece to note is that there's a privacy notice embedded in our application. We are required to give a privacy notice to everybody we serve. It lets a person know how information about them is used and disclosed. So that privacy notice identifies the things that they need to know about that. And again, one other key piece for students who are potentially eligible is that we're able to share information with contracted service providers. So I have that towards the bottom of the screen here. There's 3 bullets towards the bottom, and it says VRS contracted providers. So that's where we let them know that we're able to share information with those entities, as well as others. But so you'll want to read through that privacy notice to know what's in there. And then when you go to the bottom of the first page, it's all basic information about a person, their contact information. I do want to call out Social Security number. We do ask for Social Security number, and we do want to get a Social Security number as much as possible. It helps us long-term be able to track data in terms of employment outcomes for people. Over the long term, we are going to want to be tracking students that receive services as a potentially eligible student to look at those outcomes. But if a student does not provide it and they refuse to, you are still able to enroll them and serve them, but try to get that Social Security number as much as possible. Okay, so other basic information that's pretty straightforward is what we ask. Page 2 asks for information about their parent or authorized representative. Then we get into some other information about their communication preferences and what technology they use, what accommodation needs they have. Some of those things are optional. If they don't complete them, that's okay. You could also ask them about it later. We do need to know, we have to report to RSA on race and ethnicity. And then when you get to page 3, we have a section here that says, I wish to receive the following pre-employment transition services. So we have the 5 listed. And this, the Rehabilitation Services Administration, again, requires us to assess a student's needs for services. One way we can assess those needs is just by asking a student what they want. So it's a pretty easy process when it comes to serving potentially eligible students. So this is one way that we are documenting how we're assessing a student's needs. Now, when you get the application returned from a student, It's really important to review, especially this section with the student, because they may or may not have known what they were checking. So you might want to just review, not might want to, you will want to review the 5 pre-ed services, talk about what they checked off, see if there's something more that they want to check after having that discussion. But also keep in mind that this is just one point in time. So I get questions sometimes from our pre-ed representatives about, hey, a student didn't check off something on the application. Can I then provide it later? And the answer is yes, absolutely. As long as you are documenting in your case notes why you're providing a service, and it could be as simple as the student has said they're interested in it, that's fine. You can always provide it even if it's not checked off on here. All right, so communication preferences, treating you fairly, some of those basic things that we have to let everybody know. And then let's review the end of this form. So first of all, there's a section on here where a student and or their parent or guardian or authorized representative can sign, which is one way that we're getting permission from parents in order to provide pre-eds to the student. But keep in mind that you don't have to have a physical signature from the student or their parent or guardian. You do have other options, which is fabulous. One option would be, say you could have a phone call or a virtual meeting with the student and or their parent or guardian. So if they're under 18, it would need to include their parent or guardian. But you could go through the application, you could complete it, and then you could ask them, okay, so are you giving permission for the student to receive pre-ed? They say yes, then you can fill out this VRS staff only. It's optional, so you don't have to do it this way. But you could check off that you reviewed this application with that parent. You could give, then you need to give the date, then you give the name of the person, and then your name on here. So it's an option for you. You don't always have to get a signature. You can go through the application and sign this section, which is really cool. And one other piece, there's another optional section that says school staff only disability verification. So we do have to verify that a student has a disability, and we have to get that verification from a professional or from an official record. So one way of getting it from a professional could be from the school, and the school staff could complete this section where they say, yes, the student's enrolled in a secondary school, and I know that the student has, one of these things, an IEP, 504 plan, a medical record or doctor's note, or maybe it's something else. And then they can give their name and title and sign. So keep in mind, this is one optional thing that can be completed. Another thing to keep in mind is that we're not able to ask the school to complete this section unless we have a release. However, a student can ask the school to complete this and then provide this to us. So that's a nuance in all of this, keeping with data practices, laws, and everything. We can't ask for it, but a student can. And in a moment, I'm actually right now going to go back to our slides and review other ways that we can document or verify that a student has a disability beyond just that section on the application. So, get my notes back out here. It could be a case note. So this is another way that you can document. You could enter a case note that documents that you observed, reviewed, or received a statement from an educator or a professional that indicates that the student has a disability. Other professionals can be beyond the school. It could be a county case manager. It could be a contracted community partner, just any professional that has documentation that a student has a disability. It can't come, verbally from a student or a parent. But when you go to I'm going to jump to the third box on here, they can give you or show you documentation. So if they have an IEP, a Social Security beneficiary award letter, an evaluation summary report, a 504 plan, or other sort of medical or psychological documentation, they can show it to you, they can give it to you, and that's how you can verify. That second box reviews what we've already reviewed, which is another way you can document or verify disability is that school staff only section on the application. So keep that in mind, because I think some staff kind of get stuck in their mind that they can only get that school staff only section, and that's just one option. Okay, so once you have the application and you have that disability verification, that's when you enter the student into our case management system, Workforce One. Many of you probably have already received training on Workforce One. Some of you might not have received it yet, but if not, you will soon. Note that pre-ETS representatives have a different entry point into Workforce One, which is called the pre-ETS referral side. Our counselors have a different side of Workforce One. It all looks similar, but just two different entry points. So all application forms, consent forms, disability documentation, anything you receive like that must be uploaded into Workforce One. And you're going to need to work with a VR technician from your team to do that uploading, because they have special software that saves the document in an accessible format first. So keep that in mind, that we need documents to be accessible before they can be uploaded in Workforce One, and that our VR techs are able to do that. You will then use the information on the application form to enter the data fields in Workforce One to get the student enrolled as a pre-ETS potentially eligible student. Okay, let's move on to the next part of the process, which we've talked a lot about, but it's assessing the needs of the student, the pre-ETS needs that they have. So as I already noted, the first thing you'll want to do when you're meeting with the student is to review their application form and what they checked on there. And I have another little note on here that, again, if they didn't check something, that's okay. You can still provide that service later if there's a need. Another optional resource for you that you can use in like that first meeting with the student is the pre-ETS student survey. And I'm just going to show that. It's linked again on that slide. But it's another form that kind of helps you through that conversation with the student. So it goes through the 5 pre-ETS services and lists some questions you can ask them. So job exploration counseling, some pretty basic questions. What is your job or career goal for after high school? Have you explored your interests and have you explored different job opportunities? And then another piece, again, that's always really important to ask is, what are you currently getting from the school, or things that you already have received from the school, so that we know we're not duplicating services or making them start from scratch if they've already been involved in other things with their school. So this is a 3-page document. We go through the 5 pre-ETS services. Feel free to use it. Feel free to alter it. It's just a tool for you in having those pre-ETS needs conversations. And as we note on here, again, it's a starting, you're just trying to find that starting point. So maybe it's the student says, right now I want to understand like where my interests are and what job opportunities there might be. And you can just start there. Maybe it's a work experience, maybe it's workplace readiness training, whatever it is, find that starting point, and then you can build on services from there. Informed choice is a really important part of the whole process with pre-ETS services to students, and just want to review that a little bit here. It means that students are active and full partners in the entire process. Informed choice means that students understand that they have choices and that they fully understand what the 5 required pre-ETS services are, that they know that they can choose which of the pre-ETS services they receive, and that they also have choices in how they receive those services. All right, so next in the process is referring students to a provider as much as possible. This is a visual just summarizing the system that we are in the process of still creating, which is bringing together VRS, schools, and our community partners. One system providing pre-eds to students across the state. So who are the community partners? We call them community partners, but they're also known as our providers or our vendors. There's a lot of different terms that can be used. But when we say community partners or providers or vendors, we're referencing those entities that have a professional and technical contract with us, or a PT contract. At this point, we have over 150 organizations that have contracts with us across the state. On this slide, I have linked a SharePoint page where you can find all the partners that have pre-eds on their contracts. And when we get into modules 5 and 6, I will be reviewing more about the process of making referrals and authorizing services to those community partners. This slide reviews the types of community partners that we do have those contracts with. There are two types. They can be a CRP, a community rehabilitation program, and they're CARF accredited. That basically means that they pay for an accreditation and they follow certain standards, which allows them to have no limit on the amount of funding that they can receive from VRS. Limited use vendors, on the other hand, otherwise known as LUVs, are not CARF accredited. So that means that they actually have a limit on the amount of funds that they can receive from VRS, and that equates to $200,000 over a 2-year period. Sometimes you might hear that you are unable to make a referral to a certain provider because they've reached their limit. So those that are considered either a CRP or an LUV can be any number of type of organizations. So it could be a nonprofit or a for-profit. We also have contracts with all 8 Centers for Independent Living, or CILs, across the state, as well as 9 of the 16 Career Force Title I partners. If you have questions about the Independent Living Center or Career Force Title I partner or partners in your region, reach out to your RAM or other staff members to learn more about who they are and the contracts that we have with them. And this slide reviews the referral process, but again, we're going to get into it more in modules 5 and 6. But it essentially involves, number 1, completing a pre-eds referral form and sending it to our provider, creating a service authorization, which authorizes a certain number of hours and amount of time to serve a student. And then your role will be providing oversight. Once services get started with a provider, you, the student, and the provider will discuss a communication plan going forward. And then your role will be to monitor that. How is it going? You'll be collecting reports and invoices and approving them going forward. So next in the process is follow-up. Again, so once a student is moving forward with a provider, you'll be following up to make sure that those services are going well. And you can provide that follow-up, and that student can receive services as long as a student is in an education program and under the age of 22. Keep in mind that if or when a student you're serving graduates from high school and attends post-secondary education, that you can still follow up with them and provide any needed pre-eds during that time as well. You're going to want to track any results or outcomes that a student achieves while receiving pre-eds. Again, we have the pre-eds framework that can help you decide which results those will be. It really helps you to, just track their progress. Keep in mind again that students do not need to achieve all the performance measures that are listed in that framework. It is just meant to be a guide. And then also be asking your providers to document the results that the students achieve in the reports that they send you, because it really allows you to understand what's happening. And then in our service record, say a student ends up moving into our general VR program, it's really nice for the counselor to understand what has occurred and what has the student achieved along the way with receiving pre-ed services. So we'll go into a little more information about that referral to the general VR services with a counselor. As is noted on this slide, timing is really the key when it comes to making those referrals. So one point in time is when a student is getting close to leaving the education system or aging out of pre-EDS at age 22. Certainly not all students who are receiving pre-EDS as a potentially eligible student are going to need or even be interested in the general VR program. But those that clearly have more needs for support, it's really good to get that referral process going well before pre-EDS as a potentially student end. There are other points in time earlier in the process when it is clear that a student has more support needs. A good example is when a student needs a work-based learning coach in order to be able to participate in the work experience. I underlined on here in the near future, because if a student who's going to need a work-based learning coach is not ready for a work experience or is not likely to participate in one anytime soon, then maybe that referral to the general VR program doesn't happen just yet. It can happen later down the line. To decide if a student should apply to the general VR program, you can ask yourself, can the student accomplish their vocational goal without those VR individualized services? Some things that really help you answer that would be to look at, does the student, are their needs met through, say, a resource room or other community resource at the school? Are their needs being met by another agency that's serving them? Is there a very unique need only we can fill? So those are just some things to be asking. And always keep in mind the time it takes for a student to apply for that general VR program, for eligibility and priority for services to be completed, and for an employment plan to be put in place. You don't want to have to rush those things in order for the services to begin. Lastly, as with all things, it is best to consult with the counselor assigned to the school and or your RAM when you're not sure if a referral is appropriate. This reviews the processes for what needs to happen in order to provide services to a student. So we have on the left, pre-EDS for potentially eligible students, and then on the right, what the process is for our general VR program. So a student who's potentially eligible, they need to complete an application. Then you as a rep will verify their disability, age, and their student status. And then next, you provide pre-EDS that are needed. For the counselor in serving through the regular VR program, they too get an application, and then they determine eligibility and priority for services. And we'll be offering for you all later in your first year with the agency a training on the general VR process so you can understand what's involved with eligibility and priority for services and some of these other things. So just keep that in mind too. After those items are completed, the counselor then needs to complete what's called the assessment of VR needs. Then with the student, they complete an employment plan. And then once the employment plan is in place, they're able to provide services. So it's more of an involved process that needs to happen. And we need signatures on the employment plan. So all those things need to take place. On the next few slides, we've listed all the possible services that can be included on the employment plan. We're not going to go through those in depth, but I have included a link to our policy and guidance chapter so that you can see, if you're interested, what's included in all these different services. So those can include counseling and guidance, information and referral, physical and mental restoration services, vocational and other training, maintenance. And by the way, maintenance means monetary support provided to an individual for expenses such as food, shelter, and clothing that are in excess of normal expenses for that person. So for students, maintenance can include, like, if they need a uniform or some certain type of footwear that they need for their work experience. Those are some examples. Transportation, auxiliary aids, job-related services, which includes job placement, job retention, and follow-up and follow-along services, supported employment services, personal assistance services, occupational licenses, tools, equipment, initial stocks and supplies, rehabilitation technology, we're almost there, transition services, assistance with developing a small business, and then other services determined necessary. That's quite a bit. Also, it's really important to keep in mind that pre-eds can continue once the student applies for the general VR program. They don't have to end, and you can still be involved. There's this, and I'm going to talk about that on the next slide. There's a transition period, but that student can continue to receive any pre-ed services all the way through until their employment plan is put in place. And that counselor is just going to need to be sure to include any pre-eds that need to continue onto the employment plan. And that's up to them to know, and that's part of their training, but just it's very good for you to know that too. So transitioning to the counselor, again, you as a pre-eds representative, it's really important to keep working with that student while there is that transition period. We certainly don't want a hard stop and the student to wonder what's going on. And some students might need a lot more time to transition than others. So it's really dependent on that relationship that all three of you, the counselor, the student, have figured out together. And then just keep in mind, though, the pre-eds rep wouldn't continue indefinitely on the case. The idea is to make sure it gets transitioned over and then you come off the case. Of course, you're always, depending on the relationship you've established with that student, you're always there to help with the case in the future if there's things that come up and you have some good information that can be helpful, things like that. So this is a summary of the full process from referral through the whole case management that you will be providing. The first box, you as a pre-eds rep will receive a referral from the school, a family, from the student, etc. So you receive that referral. The student completes the application. You're going to enter data into Workforce One after you've received the information that you need. You're going to assess that student's need for pre-eds. Then you're going to be providing or arranging for those services that the student needs, and then follow up with the student and the provider to make sure things are going as planned, or help if they're not going as planned, as well as referring the student to general VR services as needed. All right, let's get into case notes because that's an important part of this whole process. Policy and Guidance Chapter 15 reviews the record of service. And we're just going to review a few points and about that. You also will be receiving a separate training on case noting. But just want to remind you that electronic record of service for that student contains the information that is required by law for us to have that demonstrates that we're using our resources properly. It provides the basis for the decisions that are made. It maintains up-to-date records that facilitate other staff in serving that person. And also keep in mind that some information will be in case notes, and other documentation of what's happening could be in a report that you're receiving from a provider. The purpose of case notes is, pretty broad. It provides summary information It's a snapshot of the work being done. It links services and activities to the strengths and needs of a person. It provides accountability. It helps us fulfill ethical requirements. It helps to verify what's been done. It ensures accountability and optimization with our partners, and it reflects all the counseling discussions that have occurred. Please just keep in mind, in summary, with case notes, that you will want to case note all encounters with a student or all attempted encounters with the student, so that it's just recording everything that you've done. It's important to document if you're unable to reach a student or the student doesn't show up for an appointment. If there's a big gap in time and it doesn't explain why there is a big gap in time, somebody looking at that case might be wondering what's going on. So in other words, case notes tell this story. If another person picks up the case, they should be able to know exactly what's been done and why. And if somebody needed to take the case, you know, let's say you transferred to another office or took another job, whatever it might be, for somebody else to pick up the case and take it from there. That's what you got to think about when you're doing your case notes. So another really important aspect related to case notes is tracking the pre-ETS activities. So RSA requires VR agencies to report to them every quarter in the program year which of the 5 pre-ETS required services a student receives. So to get the real-time information to RSA, we report which non-purchase services that a student receives through case note categories. So this is some screenshots from Workforce One. So when you go to Case Note Add in Workforce One, this screen will pop up. The category is a required section. When you scroll down, you'll see the 5 required pre-ETS services listed. And then if you need, if like you meet with a student and you are providing or arranging for more than one pre-ETS service, you can click on that select, deselect option, which is right under the drop-down menu, and then select as many categories as were provided. And I want to emphasize once again that you'll want to use case note category when you're providing a service to a student, but also when you're arranging for those services too. So arranging means to discuss, identify, plan, or schedule pre-ETS activities for a student. It occurs in collaboration with that student, and it can include anyone on their team, so their parents, school supports, or others. Examples of arranging can include informed choice discussions about the available services, what their interests are, what their needs are. It can include engaging their family in discussions and planning. It can be about reviewing comparable services and benefits, so what's available at the school or elsewhere in the community. It can be about scheduling or enrolling the student in services delivered by a provider. And it can also be about communicating to the family and the school any anticipated pre-ETS services that are going to be provided and making sure that roles and responsibilities are coordinated. We mentioned this in a previous module, but it's really important to remember in terms of IEP meetings and case note categories. So after attending an IEP meeting, you will want to use the IEP meeting case note category, but you're also going to want to select any pre-ETS services that were discussed or arranged during that IEP meeting as well. Also, there are, at this point, 11, maybe more, I think our independent living centers too. We have 11 providers, and then I think the independent living centers provide their reports to us through case notes. So they have access to Workforce One. We are moving towards that model with all of our providers in the future, and you'll hear more about that when we get there. And you would want to talk to your RAM and ask which providers in your area are entering case notes directly into the Workforce One system. Just keep in mind that those providers, when they enter a case note, they should not use the 5 pre-EDS categories. We've instructed them on that, but you never know. Sometimes they get new staff and maybe they weren't trained or whatnot. They should be using the pre-EDS vendor reports category when they enter in their case note, and that's how they report to you. And then the last note here in case notes is that you want to, again, have your case notes clearly describe any pre-EDS services you provided and why. And so we have an example here of a case note that pertains to a student named Grant. And it's pretty simple. Grant has never had a work experience, so I will be referring him to the XYZ CRP to assist him with finding a pre-EDS work experience. He would like to find a retail position in order to learn basic work skills. It's just an example of how you're verifying what you're providing and why you're providing it. So let's end with a quiz, and then we'll be done with this module. So as always, take out a piece of paper, pause the recording, and answer the next 8 questions that are on the next 2 slides. And then once you've answered those, press play, and then we'll review the answers together. Okay, let's review the answers to the following 8 questions. Number 1, you and the counselor assigned to a school should work as a team to serve the school. Of course, that is true. That's very important. Number 2, a primary focus for the pre-EDS representatives are students in 18 to 21 transition programs. That is false. We really want the counselors to serve those students. Most of those students are in 18 to 21 transition programming because they have more significant needs. So it makes more sense for them to apply, typically anyway, directly to the VR program. Number 3, VRS staff must obtain a pre-application privacy notice before getting a list of student names and contact information from the school. That is false. Again, you can receive basic information about a student, their name and their contact information. That's considered directory information. You don't need a release. You don't need a pre-application privacy notice to get that information. Number 4, the pre-EDS application should be printed on yellow paper, light yellow paper. That is true. Again, that helps distinguish between our 2 applications when they're kind of floating out there in the community sometimes. We don't want them just floating around, but sometimes that happens. Number 5, VRS has 2 types of PT contracts, CRPs and LUVs, and that is true. Number 6, the only way to verify that a student has a disability is for the student to complete the school staff only section of the pre-EDS application. And again, that is false. You can go back to slide 26 where we list all the different ways that you can verify disability. The school staff only section is just one option. Number 7, you should use 1 or more of the 5 pre-EDS case note categories when you meet with a student to work on arranging pre-EDS services. And that is true. Arranging the services is still considered a part of providing the services. And last but not least, number 8, I would only enter IEP meeting as the case note category when I case note on an IEP meeting. And that is false. You would also want to include any pre-EDS services that you discussed or arranged for during that meeting. All right, we have finally come to the end of this training module. As always, consult with your RAM or reach out to me if you have any questions. Thank you.